In our later years, health becomes our greatest asset. When we're young, the body forgives many of our choices. But after age 60 or 70, every habit, every decision about food, movement, or lifestyle has a noticeable impact on how we feel. One of the most serious and often underestimated challenges at this age is osteoporosis. Most people don't think about it in advance because bones don't hurt until a fracture happens. And those fractures, caused by fragile bones, can suddenly change everything. Quality of life drops, independence is lost, and recovery can take months. Osteoporosis is often called the silent disease because it develops quietly, year after year, until the bone becomes so weak it can break from a fall or even a small awkward movement. The hip, spine, and wrist are the most common trouble spots. While younger people usually heal quickly from a fracture, for older adults, recovery demands tremendous effort and often leads to complications. According to the World Health Organization, 1 in 3 women and 1 in 5 men over 50 will experience an osteoporosis-related fracture. After age 70, the risk is even higher. But here's the important point. Osteoporosis is not inevitable. It can be prevented, slowed down, and even partly reversed. What happens to bones as we age? A bone is not a stone. It's a living, dynamic tissue. Inside, there's constant work. Old cells break down, new ones form. In youth, this balance is perfect. Destruction and rebuilding stay in sync. But after about age 40 to 50, rebuilding slows down. Gradually, bones lose density and become weaker. Women after menopause are especially vulnerable. The sharp drop in estrogen speeds up bone breakdown. But men aren't immune. Declining testosterone, reduced activity, and age-related illnesses all play a role. Why osteoporosis develops? Several factors accelerate bone loss. Age-related changes. After 60, 65, everyone loses bone density, but the pace depends on lifestyle, diet, and health. Hormonal changes. For women, menopause. For men, the gradual decline of testosterone. Hormones directly regulate the cells that keep bones strong. Without them, bones weaken. Lack of calcium and vitamin D. Calcium is the main building block of bone, and vitamin D helps absorb and deliver it. Without them, bones weaken. Sedentary lifestyle. Bones respond to stress and resistance. When muscles work, bones get the signal to strengthen. Too little movement, and bones start to weaken. Long-term use of certain medications. For example, corticosteroids, often prescribed for chronic illnesses, can accelerate bone loss. Smoking and alcohol. These habits harm not only the heart and blood vessels, but also calcium metabolism, lowering bone density. Genetics. If parents had hip or spine fractures later in life, their children's risk is higher. Consequences you should know. Osteoporosis doesn't just mean more fractures. It gradually reshapes daily life. The spine can curve, posture changes, height decreases, back pain becomes chronic, fear of falling grows, leading to less movement, and the vicious cycle begins. Weaker muscles, worse balance, and even greater fracture risk. Hip fractures in older adults are among the most dangerous outcomes. More than 30% of people over 70 never regain their previous independence after such an injury. That's why prevention matters long before a bone breaks. What you can do right now. Talk to your doctor. There's a special test called a bone density scan, a DEXA scan, that measures bone strength. It shows whether osteoporosis is a risk or has already begun. Focus on nutrition. Many older adults don't get enough calcium and vitamin D. Dairy, fish, nuts, leafy greens, all are key calcium sources. Vitamin D comes partly from sunlight, but after age 60, supplements are usually needed, especially in northern regions. Stay active. Even if you've never been into sports, simple walking, light exercise, or strength training with small weights or resistance bands can make a big difference. The secret is consistency. Reconsider habits. Smoking and heavy alcohol use are incompatible with strong bones. Quitting both is one of the most powerful steps towards healthier aging.
Osteoporosis is often called the silent thief of bones. It develops slowly, without obvious signs, which is why many older adults only discover it after a fracture. But if you pay close attention, the body does send early warnings. They're not always obvious, but they can help you take action before it's too late. Early signs and symptoms. Loss of height. A person may notice they've shrunk by 1 to 2 inches compared to their younger years, often due to tiny spinal fractures. Stooped posture or a hump. Changes in the spine are classic signs of advanced osteoporosis. Chronic back pain. It may feel dull and aching, sometimes sharp with movement. Fractures from minor accidents, for example, breaking a wrist from a simple fall at standing height, or cracked ribs after a strong cough. Reduced stamina, fatigue, weakness, and moving more cautiously are all signals. If these symptoms appear, the disease is already underway. But even at this stage, much can still be done. Why nutrition matters so much? Bones are not just calcium. They're a complex structure of minerals, proteins, and vitamins. Under a microscope, bone looks like a collagen framework reinforced with calcium and phosphorus. To keep this framework strong, the body needs both building blocks and the workers, enzymes, hormones, and vitamins. Unfortunately, diet often worsens with age. Appetite declines, dental or digestive problems appear, and many people cut back on dairy due to intolerance. The result? Deficiencies that weaken bone strength. Calcium, the building block. Older adults need more calcium than in their younger years. After age 60, the recommendation is about 1,200 milligrams per day. To put that in perspective, a glass of milk, 250 milligrams. A slice of cheese, 200 to 300 milligrams. A cup of yogurt, 200 milligrams. Getting the full daily amount from food alone can be difficult. Good calcium sources include dairy, leafy greens, nuts and seeds, sardines and salmon with bones, fortified foods, some juices and breads. If diet falls short, supplements may be recommended, but too much calcium can build up in blood vessels, raising heart risks. That's why calcium should be paired with vitamin D and always discussed with a doctor. Vitamin D, the gatekeeper. Without vitamin D, calcium can't be absorbed. But as we age, skin becomes less efficient at producing it from sunlight. Even in summer, vitamin D levels in people over 70 are often below normal. Recommendations: 800 to 1,000 IU per day, sometimes more if a blood test shows deficiency. Sources include sunlight, though less effective in seniors. Fatty fish, salmon, herring, mackerel. Cod liver oil, eggs, fortified dairy products. For most older adults, supplements are the most reliable option. Protein, not just for muscles. Protein is often overlooked, but it's crucial. It builds the collagen matrix in bones and supports muscle strength. Without enough protein, even calcium can't be fully used by the body. Recommended intake: 1 to 1.2 grams per kilogram of body weight daily. For a 155 pounds, 70 kilogram person, about 70 to 85 grams of protein per day. Examples: 3.5 ounces, 100 grams of chicken or fish, 20 grams of protein. 2 eggs, 12 grams of protein. 1 cup of milk or kefir, 8 grams of protein. A serving of cottage cheese, 15 to 18 grams of protein. Balanced combinations work best: yogurt with nuts, fish with vegetables, eggs with whole grain toast. Magnesium, vitamin K, and other helpers. Magnesium, around 400 milligrams daily, helps calcium bind to bone, found in nuts, beans, and whole grains. Vitamin K2 directs calcium into bones instead of arteries, found in fermented foods like Japanese natto and cheeses. B vitamins, especially B12 and folate, support bone and blood health. Absorption drops with age, so supplements are often needed. Don't forget hydration. Many older adults drink too little water. Dehydration increases constipation, strains the kidneys, and disrupts mineral balance. For bone and joint health, hydration is key. About 6 to 8 cups, 1.5 liters of fluid daily, unless a doctor recommends otherwise. When to see a doctor? If you're over 70 and notice height loss, stooping, or have already had fractures, it's essential to get checked. Bone density scanning, DEXA scan, is quick, painless, and gives a clear picture of bone strength. It allows doctors to start treatment before more damage occurs.
One of the most dangerous myths about aging is that the less you move, the safer you are. Many older adults limit activity out of fear of falling or because of back and joint pain. But the opposite is true. Lack of movement makes bones and muscles even weaker. Bones are living tissue that respond to stress. When we move, the body gets a signal. Make these bones stronger. Without that stress, bone density continues to decline. The role of physical activity. After age 60 to 70, staying active isn't just helpful, it's essential. Exercise helps strengthen bones and muscles, improve balance and reduce the risk of falls, support circulation and heart health, maintain joint flexibility, boost energy, confidence, and independence. This doesn't mean heavy workouts or marathons. Even daily walking, light exercise, and body weight movements can significantly lower fracture risk. Best exercises for osteoporosis. Walking, the most natural and accessible option. A 30 to 40-minute walk each day strengthens the spine and leg bones. Body weight exercises. Wall sits, calf raises, gentle push-ups against a wall or table. These create safe pressure on bones. Strength training, small dumbbells or resistance bands, just 10 to 15 minutes 2 to 3 times a week makes a difference. Balance training, standing on one leg, yoga or tai chi. These reduce fall risk, crucial for people with osteoporosis. Stretching, gentle flexibility exercises support posture and joint mobility. The golden rule? Consistency. A little every day is better than rare, intense workouts. Safety first. With osteoporosis, some movements should be avoided. Bending forward with a rounded back while lifting, sharp twists of the spine, jumping or high-impact activities like running on hard pavement. Exercises should be gentle and safe. Always consult a doctor or physical therapist before starting a new routine. Medical diagnosis. The most reliable test for osteoporosis is bone density scanning, or DEXA scan. It's painless, quick, and measures bone strength in the hip and spine. The results help doctors assess fracture risk. In addition, blood tests may be needed to check calcium levels, vitamin D levels, hormones in women, estrogen, in men, testosterone, bone turnover markers. Together, these tests help identify not just osteoporosis, but also its root causes. Treatment options. If osteoporosis is already present, diet and exercise alone may not be enough. Modern medicine offers several treatments to slow down bone loss and, in some cases, rebuild bone density. Main options include bisphosphonates, slow bone breakdown and reduce fracture risk, usually prescribed in courses under medical supervision. Calcium and vitamin D, a standard part of almost every treatment plan. Hormone therapy, in some cases estrogen replacement for postmenopausal women or testosterone therapy for men. Newer medications such as denosumab, monoclonal antibodies, or teriparatide, a hormone-based therapy that stimulates bone growth.
These are used for severe osteoporosis. Important, only a doctor can prescribe these. Self-treatment is unsafe. Therapy must be tailored individually, taking into account age, overall health, and tolerance. Recovery after a fracture. If a fracture does occur, especially of the hip or spine, recovery requires a comprehensive approach. Surgery or fracture stabilization, physical therapy and gradual reintroduction of movement, emotional and family support, psychological counseling to overcome the fear of falling again. Many seniors avoid activity after a fracture, believing it's safer, but it's the return to safe, supervised movement that speeds recovery and lowers the risk of future fractures. Lifestyle habits that protect bones. Quit smoking. Smoking accelerates bone loss. Limit alcohol. An occasional small drink may be fine, but regular alcohol intake weakens bones. Aim for a balanced, healthy weight. Get fresh air and sunlight. Even short walks outdoors help with vitamin D production and improve mood. Confidence and support. Osteoporosis doesn't just affect the body, it affects the mind. Older adults may start fearing stairs, avoiding the outdoors, or giving up daily routines. Support is key. Group exercise programs for seniors, walking clubs, or even simple family walks can restore confidence, independence, and joy in movement.
When people think about health in old age, they often imagine pills and medical tests, but mindset is just as important. Your attitude toward yourself, toward movement, and toward aging. Osteoporosis doesn't only bring physical fragility, it also often brings fear. Many older adults start worrying about falls, avoiding guests, or staying home most of the time. And this creates a vicious cycle. Less movement, weaker muscles, higher risk of falls. Fear of falling. We have to talk about this openly. Fear is a natural reaction, but it shouldn't control your life. If you're in your 70s and find yourself avoiding stairs or long walks, that's a signal, not to stop moving, but to adjust how you move. There are special fall prevention programs where seniors learn safe movement, balance training, and even how to fall in ways that minimize injury. Gentle practices like yoga or Tai Chi also help. They strengthen the body and calm the mind. Preventing osteoporosis. Prevention is always more powerful than treatment. And even if you've already been diagnosed, prevention slows the process and lowers the risk of complications. Daily habits that protect your bones. Nutrition. Keep up calcium, protein, and vitamin D. Activity. Walk, do light exercise, and train your balance. Checkups. Follow your doctor's advice on bone scans and blood tests for vitamin D and calcium. Home safety. Remove slippery rugs, install grab bars in the bathroom, make sure lighting is good. Small steps lower fall risk. Weight control. Avoid both extreme weight loss and excessive weight gain. Practical tips. Make water a habit, a glass in the morning and evening. Add protein to every meal, an egg, cottage cheese, fish, lean meat, or beans. Go outside for 20 to 30 minutes a day. Even a short walk helps both bones and mood. Keep calcium-rich snacks handy, like yogurt or almonds. Practice standing up and sitting down without using your hands. It strengthens legs and balance. Take your medications exactly as your doctor prescribes. The role of family. An older adult's health isn't just their responsibility alone. Family support makes a huge difference. Gentle reminders about medications, an invitation to take a walk, help with groceries, or preparing healthy meals. All of these turn prevention into a normal part of life. What matters most is balance, knowing someone cares while also respecting independence. Osteoporosis isn't a sentence, it's a condition that can be managed. Emotional health and bone health. Science shows that mental health directly affects physical health. Chronic stress raises cortisol, a hormone that breaks down bone. Loneliness and depression reduce appetite, motivation, and physical activity. That's why joy and connection are as important as medicine. Time with friends, talking with grandchildren, hobbies, social groups, all of these strengthen both the spirit and the body. An inspiring conclusion. If you're in your 70s and think osteoporosis is unavoidable, hear this truth. Your bones can be protected at any age. We can't stop time, but we can make it gentler. Every small step counts. A glass of milk, a short walk, light dumbbell exercises, a few minutes of sunshine, a good conversation. Each one is a building block in the fortress of your health. Osteoporosis isn't a reason to live in fear. It's a reason to live with more care, more awareness, and more support. Life after 60, after 70 can still be active, joyful, and meaningful. Your bones and muscles are not weak points. They're the foundation you can strengthen every single day. Every day is a chance to keep mobility, confidence, and independence. Strong bones are more than physical health. They're the foundation of freedom. And freedom in old age is priceless.